Hello and welcome to CodeSure, a place to learn about medical coding and billing. Today we're going to look at what is medical coding and billing? What certifications do you need? What are the best ways to learn? What does learning cost? What is right for me? Today we'll look at answers to those questions and maybe ask a few more. Let's get started. Let's look at what medical coding is, but you often hear the term medical coding and billing. That's because in many offices, one person may be responsible for both the medical coding and the medical billing, or separate positions of medical coding and medical billing must work very closely together. The two are intertwined in terms of revenue results, so we'll start with medical coding and touch on medical billing. Let's move forward. A medical coder converts medical information into alphanumeric codes. That means codes that contain alphabet letters and numbers. These codes are applied to multiple types of data. There are codes for diagnoses, there are codes for procedures and treatments, and there are even codes for medical equipment. Information is obtained from the physician's notes, test results, and other medical documentation. Not only must you understand coding, you must also understand how to review the notes, test results, and medical documentation to apply the codes. This is why a course in medical terminology is so important when learning medical coding. Medical coders typically use three basic classification systems, and you can see the code books here on the slide. Current Procedural Terminology, called CPT, Healthcare Common Procedure Coding Systems, HCPCS, and this is derived from the ICD-10 PCS, and the ICD-10, which stands for the International Classification of Disease, 10th revision. By the way, there's an 11th revision, which will come out approximately in January of 2022. The ICD-10 is owned and copyrighted by the World Health Organization. The World Health Organization has authorized the development of an adaptation of the ICD-10 known as the ICD-10-CM for use in the United States. This is published by the American Medical Association. The code systems and classifications used in medical coding are a form of communication. This allows the healthcare provider to accurately bill patients and their insurance companies for the services they provided to their patients. Medical billers take the information provided by the coders and use that to create invoices and send them to the payer. Some organizations do combine the role of the coder and the biller with one person performing both tasks, but this is becoming more and more rare as solo practitioners find the overhead cost of maintaining a solo practice just too great. If the functions remain separate, the two positions work closely together to ensure that the billing is accurate with the goal of avoiding all rejected claims. Healthcare documentation can be found in patient notes and other medical records and files. They use their code books to assign the correct codes, and generally they use a billing software. The type of notes used will vary based on where the coder is employed, such as a hospital or a clinic or a long-term care facility or an outpatient facility. Again, this is why it's so important to be familiar with medical terminology, and I do have a course on that as well. Coders work in multiple venues, as you can see in this slide. A survey conducted of AHIMA members for their average annual salary indicated home health coders made $56,000 annually. Long-term care, hospice, and nursing came in at $63,000 annually. Clinic or private physicians, $64,000 annually. Ambulatory care, $66,000 annually. Typically, hospitals pay the most across the board. AHIMA members reported an average salary of $77,000. The ability to code from home is a huge part of the attraction to medical coding. Let's look more closely at your options for learning medical coding and becoming certified and beginning your career as a medical coder. Let's find your best option. There are two organizations that certify medical coders. Let's take a look at both of those, what it takes to sit for the certification and how much the certification exams cost. The two medical certification exam organizations are the American Academy of Professional Coders, known as AAPC, and AHIMA, the American Health Information Management Association. The AAPC focuses on coding, whereas AHIMA has a much broader focus in terms of medical management. Both offer the opportunity to sit for the exam after you meet certain requirements. Let's take a look at what those requirements are. The AAPC certification is known as the CPC, Certified Professional Coder. Your CPC will be followed by the letter A for apprentice for a period of 2 years generally. The A will be removed after the completion of your apprenticeship. AHIMA CCA, Certified Coding Associate, does not have an apprentice level. The more advanced designation is the CCS-P, the physician-based exam. We'll take a closer look at the distinctions between the CCA designation and the CCS-P designation awarded by AHIMA. To earn the AACP CPC certification, all you must do is pass the certification exam, but it's a very difficult test. Your initial certification will be that of apprentice, and that will be represented by the letters CPC-A. After you prove that you have 2 years on-the-job experience, you can remove the A and you will be a CPC. Or you can prove 1 year of job experience and 80 contact hours of a coding preparation course. Externships are accepted. The AHIMA initial certification is CCS. You must have a high school diploma or equivalent. At least one of the following is recommended, but it's not required. 6 months of coding experience directly applying codes, or completion of an AHIMA-approved coding program, PCAP program, or completion of other coding training programs which include anatomy and physiology, medical terminology, basic ICD diagnostic procedural, and basic CPT coding. There are an abundance of courses available to prepare you for either the AACP exam or the AHIMA exam. These are not the same tests, they're different, and they're both sponsored by their sponsoring organizations, AAPC or AHIMA. Let's take a look at the cost of these exams. For the AACP exam, the cost is $399. You're also required to be a member of the AACP at $175. The cost of the AHIMA exam is $299 if you're a member and $399 if you're not. I thought we'd take a quick look also at the more advanced AHIMA certification, the CCS-P. Most of the exams become less expensive with AHIMA once you pass the CCA exam. That cost for the CCS-P is $199 for members and $299 for non-members. Exam preparation is important. Both the AACP and AHIMA offer exam prep. Remember, if you're going for the CCA, which is the AHIMA certification course, you will most likely already have taken an AHIMA-approved group of classes. But this does not mean that you will truly be ready for your exam. I believe practice exams are vitally important as well. So the cost is not inexpensive, and you need to be aware of that. Most people, almost all people, will benefit from exam preparation. But do not underestimate the value of practice exams. You can find them online for free, and certainly the exam prep courses will have them as well. That may be your very best method of preparation, in addition to an exam preparation class. Both AHIMA and AAPC offer courses to prepare for their individual examinations. The AHIMA courses are roughly $299 each, but you'll have to take several to prepare. The AAPC offers a blanket course at about $2,000. These are expensive courses, and the tests are expensive as well. While the AAPC focuses primarily on coding, AHIMA has a broader focus. There are additional credentials that you can earn, and with these credentials, you can anticipate an enhanced salary. In the table on the right, you can see the initial CCA designation indicates that according to a survey by AHIMA, of AHIMA members, the average salary was $53,000. This is not truly consistent with other surveys, but it may be for their particular survey. As you look through the additional designations and credentials, you'll see an expanding income range. Making the decision whether to take the AAPC or the AHIMA test may guide the potential for future success. However, keep in mind that the AAPC certification, CPC, at the AHIMA website, you can find additional information, average salary by job level, and salary by job setting. This excellent information can help guide you in determining where you want to work and which credentials you'd like to ultimately have. But we have to start somewhere, and that should be with the initial credential, either from AAPC or AHIMA. The choice is yours. Let's take a look at the employment outlook for medical coders. The U.S. Bureau of Labor Statistics publishes an occupational outlook handbook. I think we all know that the healthcare occupations are in a growth mode. Medical coding and billing is no different. Medical records and health information is projected to grow by 11% to 2028. While there is no exact designation for medical coding and billing, medical coding and billing is included in the topic of medical records and health information. The average pay for a certified professional coder is around $19 an hour, with an average annual income from $30,000 to $55,000 a year. Sometimes the organizational salary scales paint a little rosier picture, and that may be because their members do make a higher salary. But I think it's important to understand what the average salary or hourly wage for all medical coders and billers is. The AAPC has a regional breakdown of expected average salaries for certified professional coders. Here you can see in various parts of the country the salary range for your geographical location. The AAPC offers the opportunity to test and become certified for various levels of coding. The CPC-A, or the apprentice level, is the first level. Once the A is removed, you will advance to CPC, and as you can see, your salary will jump from roughly $33,000 a year to $40,000 a year. The AAPC also offers the opportunity to become certified in more advanced levels and enhance your salary. Your CPC-A is just step one, but it's the first step and the most important. Let's review the various ways to learn medical coding and billing. This can be a little confusing at first, but medical coders typically use three basic classification systems: the CPT, Current Procedural Terminology, Healthcare Common Procedure Coding System, called HCPCS, and the ICD-10, which stands for the International Classification of Diseases, 10th revision. And keep in mind, there will be an 11th revision in January of 2022, although we do not know for sure that the United States will adopt it timely. In summary, you'll need to understand three types of coding: the CPT 2020, the ICD-10 PCS, and the HCPCS Level 2. Let's start by looking at the ICD-10. First, you may wonder what's the difference between the ICD-10 and the ICD-10 CM. Because the ICD-10 is owned by the World Health Organization and used internationally, it's known as the ICD-10. The ICD-10 CM is a clinical modification published by the American Medical Association and used in the United States. So where did the Centers for Disease Control come into all of this? The National Center for Health Statistics has created the ICD-10 CM browser tool. This is a web-based query application that allows you to search for codes from the ICD-10 either by the term or the code. And I have several classes devoted just to this topic. This represents a great way to become familiar with the ICD-10 and with all coding in general. This is a new application just introduced in January of 2020, and it's incredibly helpful for new coders. I want to take a quick look at the ICD-10 CM browser tool located at the Centers for Disease Control and Prevention website. Before you purchase your coding book or enroll in a class, this is a great way to become familiar with medical coding. As you can see, there are two entry fields. One, search for terms, and the other, you can enter the code if you know it. You can link to icd10cmtool.cdc.gov. A link is found below in the text. Take a look at this incredible and helpful tool. Also, you need to be aware there's a free ICD-10 course sponsored by the World Health Organization. Now, this is not the ICD-10-CM, but the regular ICD-10. But this can be very helpful when you're first learning coding. Also, be sure to check some of my free courses. on how to use the ICD-10 browser tool. I thought we'd take a quick look at the World Health Organization ICD-10 free training tool. For me, and maybe not for you, but this was not an intuitive training program, so I thought I'd step through with you some of the features. In the lower right-hand corner, where you see the arrow, you can link to a table of contents. This is a good place to begin. For me, it was hard to find, and I thought it'd be helpful to share some of this with you. Still, this is a great tool, and I recommend that you take a look at it. This may be the first time some of you have seen the main menu of the ICD-10. It's helpful to see how it's broken down. Here at the World Health Organization Training Tool, we see chapters 1 through 10. Infections and parasitic diseases are found in chapter 1. This would be where you would find the COVID virus. Neoplasms, these are cancers. That's chapter 2. Diseases of blood and blood-forming organs and certain disorders involving the immune mechanism system is found in chapter 3. Chapter 4 includes endocrine, nutritional, and metabolic diseases. For example, diabetes would be included here. Chapter 5 includes the mental and behavioral disorders. Chapter 6, diseases of the nervous system. Chapter 7 includes diseases of the eye. Chapter 8, diseases of the ear. Chapter 9, circulatory system. Chapter 10, respiratory system. With this main menu, you can see how helpful the ICD-10 World Health Organization pre-training program can be. I hope you'll take a look at it. Here are chapters 11 through 22. There are 22 chapters in all, both in the ICD-10 and the ICD-10-CM. Chapter 11, diseases of the digestive system. Chapter 12, diseases of the skin. Chapter 13, diseases of the musculoskeletal system and connective tissue. Chapter 14, genitourinary system. Chapter 15, pregnancy and childbirth. Chapter 16, certain conditions originating in the perinatal period. Chapter 17, congenital malformations. Chapter 18, symptoms, signs, and abnormal clinical and laboratory findings not elsewhere classified. Chapter 19 and 20, injuries and poisonings. External causes of morbidity and mortality. Chapter 21, factors influencing health status and contact with health services. Chapter 22, and the last chapter, codes for special purposes. Let's learn more about the ICD-10, the ICD-10-CM, the American Medical Association version of the ICD-10, and the ICD-10-CM browser tool. The ICD-10 and the ICD-10-CM are divided into 3 volumes, although they're located in one very large spiral-bound text. Volume 1 is the tabular list of diseases. These are the actual problem. Volume 2 is the instruction manual, which explains how to use the ICD-10 or the ICD-10-CM. Volume 3 is your alphabetical index. This is where you begin to search for your disease or your injury. Generally, all searches begin in Volume 3. It's important to know that the World Health Organization provides access to each of these volumes, as indicated below each text and found in the text below this video. Another great free resource to begin to understand medical coding and billing. Volumes 1 and 3 will be the volumes you use to identify and code diseases and injuries. The process is to check Volume 3, or the index, for a code representing your disease. Then turn to Volume 1, or the tabular list, and confirm your code. Remember, Volume 2 is your instruction and your guide to using the ICD-10. The ICD-10 is a good place to begin to learn medical coding and billing. You can do this by purchasing the ICD-10 CM 2020 or an older version such as the ICD-10 CM 2018 or 2019. You'll use volumes 1 and 3 together to find the codes for each case. If you'd like to begin without purchasing a text, use the World Health Organization, WHO, free PDFs for volumes 1, 2, and 3 of the ICD-10. Now, this is the ICD-10 that the World Health Organization offers, and not the ICD-10 CM, but it's a good way to begin learning without excessive cost. Also, the CDC browser tool, which does cover the ICD-10 CM as used in the United States, is an excellent way to begin to learn medical coding and billing. It is entirely possible to begin learning medical coding and billing without spending a dime. I suggest you start with the ICD-10 CM browser tool found at the CDC website. This browser tool correlates 100% with the latest ICD-CM manuals. Also, I have free courses that explain how to use the ICD-10 CM browser tool. Be sure to check those out. They'll be helpful. Thank you for joining me and learning more about medical coding and billing. I will provide an entire free course on how to learn medical coding and billing. See you soon.